Hi, this is Dr. Karima Hirani, wanting to share one of my unique patient stories that happened just this week with all of you. My patient is a 40-year-old sickle cell anemia patient who called me up this week and said that she is in the beginning of a crisis. For those of you who are not familiar with sickle cell anemia and crisis, the red blood cells in a sickle cell anemia patient, when they become sickle, that means they've changed a shape that actually can be sort of damaging and painful as these red blood cells go through smaller blood vessels in the body, so the capillaries, and this can create tremendous pain in the patients. So her normal way of treating it would be to go to the emergency room, get admitted, get IV hydration, and then get narcotic pain meds, including IV and oral, to treat the pain. And she's usually in the hospital for about a week, and all of those narcotic pain meds just really jack her up. And she was looking for an alternative. She just didn't want to go into the hospital. So I told her, yeah, come on in, we'll give you IV saline hydration, and we'll try the PEMF machine on you. So the PEMF machine is this amazing machine. In fact, there's books written on it. Bryant Myers has written a book on PEMF, pulsed electromagnetic frequency, and versions of it are FDA approved, and they are used in medicine today for things like joint pain and swelling, and even versions of it are used for treating depression. This particular machine is an electrical coil, has an electrical coil going through it, and because it's circular, it has a magnetic frequency that comes up through the coil, and that magnetic frequency is pulsed. So we put the coil on the area of pain, and she had severe pain in her legs, and we put it on her legs, and after just a few minutes of the treatment, she was completely pain-free. She got about 1 to 2 liters of IV saline, and she went home, and she came back the next day for some more IV hydration. And keep in mind, we're keeping her out of the hospital, and she now had pain in her neck and shoulder area because the pain in the legs was completely gone. And so when we put the PEMF to her neck, the pain again was gone. On the second day, in addition to the IV saline, we also gave her a saline ozone treatment. And ozone is this another amazing natural medical drug that has just amazing properties to stimulate your own body to produce your own antioxidants. And that's what we did for her. So she felt so great. On the third day, when she came back again for some more IV hydration, there was no more pain. So she did not need the PEMF machine anymore, and all she needed was some IV hydration, and she also asked for the saline ozone. So when we can get a patient who's in the middle of a crisis completely pain-free within minutes, it's just very, very it's very rewarding. And I just think of all the thousands of dollars that could be saved in avoiding patient hospitalization, and the ability to treat sickle cell anemia like this on an outpatient basis with the machine and some IV hydration and some ozone. That's pretty amazing. That's a pretty unique story. So if you enjoyed this story and would like to hear some more similar to that in the near future, please subscribe to my YouTube channel. And this is Karima Hirani, MD. Thank you for watching.